Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. A common question that I get since I do so much breast surgery is, Dr. Shapiro, what is the difference between a breast reduction in a woman and gynecomastia surgery in a man? The answer to the question is many differences. The first thing is that anatomically, the two problems are generally different. When women need a breast reduction, usually it's a large amount of significant skin excess along with excess breast tissue. In men, it usually has to do with some fat along with a button of breast tissue that usually exists beneath the nipple-areolar complex. So you may feel, as a male patient, that you feel a protuberance beneath the nipple, and that button of tissue is what we like to remove from gynecomastia. Most often it's diffuse enlargement of the breast from fat and occasionally some breast tissue. There are many causes for gynecomastia, the most common being just a anatomic predisposition with regards to genetics. Also, people that smoke marijuana or take some medication have this at a younger age. In women, it tends to be genetic, and there are many, many causes for breast enlargement in women. The surgical approach is different in both. In women, unless we can do liposuction for the breast to remove the excess breast tissue, which is very rare, we usually like to excise some of the excess breast tissue along with excess skin. So that leaves us with some scars on the breast, but overall the result is beautiful. It's a smaller breast that feels more comfortable, it's more proportioned to the body. It alleviates some of the pain in the back and the shoulder that women have from excess breast tissue, and all in all, it's really emancipating for patients because they feel so much better about themselves, they look prettier and more proportioned. In men, oftentimes I can perform gynecomastia surgery just by performing some ultrasonic liposuction or safe liposuction. Those are two different types of liposuction. With that liposuction, I'm able to liquefy the fat that is there and also emulsify some of that breast tissue. If there is a significant amount of breast tissue beneath the nipple-areolar complex, that button that I just referred to, I will need to make a small incision around the nipple-areolar complex and remove that tissue through a very limited incision that heals beautifully. You don't know that I've been there. Very, very uncommonly are there men that have excess skin that I need to remove some of that excess skin like I would in a woman. So the differences in the surgery, the differences in the presentation are significant in men versus women. Again, women generally need some surgical procedure where I remove excess skin and breast tissue and they're left with scars that fade beautifully and they're quite happy. Men, I can either perform liposuction to remove the gynecomastia or about half the time I'll have to make an incision around the nipple-areolar complex to remove that button of breast tissue. Both are really fantastic procedures, both in men and women. I think it leaves people happier, it makes people feel more attractive, less self-conscious. Women feel like they have easier time shopping, they don't have so much attention. Men feel as though that they're less self-conscious in t-shirts, in terms of having man boobs. They also feel that they are much less self-conscious with their shirt off, and overall it's just fantastic. So the best way to find out if you're a candidate for either gynecomastia surgery in a man or breast reduction for surgery for a woman, come in for consultation, bring in some pictures of the size that you'd like to end up with, and we go from there. Thank you very much.